Did you know that less surgery for breast cancer may actually be better for a patient? Are you surprised? Let's unlock the evidence about breast cancer surgical treatment and discover the 5 reasons why a patient should consider less surgery. So there is exciting and meaningful research data to delve into in this video. Join us and discover secrets which may empower yours or a loved one's surgical treatment decision. Briefly, these are the 5 aspects which we will be exploring through this video. Firstly, we will explore 10-year survival, which is similar to cure rates. Secondly, we will look at recurrence. Both these domains determine which treatment option helps women live longer. Moving to helping survivors live more, we will uncover data on post-operative complications, quality of life, and body image issues, all of which, if not optimized, can impair a survivor's activity and view of life. Let's find out which surgical treatment option allows women not only to live longer, but to live more as well. As we already know, the surgical treatment of breast cancer can be generally classified into 2 broad categories: breast conservation treatment of BCT and mastectomy. Breast conservation treatment consists of breast-conserving surgery, which is also referred to as lumpectomy or partial mastectomy, and radiotherapy after surgery. Mastectomy is the surgical removal of the breast and can be performed with or without reconstruction. As expected, breast conservation treatment involves less surgery. We will now compare 10-year survival for the 2 main groups of surgical therapy for breast cancer. This study, done by a team of researchers in the Netherlands, was published in 2016 in a renowned medical journal, The Lancet Oncology. Here we see a chart included in their article. This chart is a survival curve. The y-axis represents the percentage of women still alive, and the x-axis indicates the time from diagnosis in years. Often more than one curve is placed on the same chart to allow us to visually compare survival between 2 treatment strategies. The researchers analyzed the overall survival of the women with stage 1 and stage 2 disease who were treated with breast-conserving surgery plus radiotherapy and compared it with those who underwent mastectomy. It is evident in this survival curve that breast conservation treatment resulted in improved survival when compared with mastectomy. A similar trend was reported in a more recent study published in 2025, where women who underwent breast-conserving surgery with radiotherapy had a higher survival rate than those who had mastectomy with or without radiation. Higher survival rates can be interpreted as better cure rates. This group of Chinese doctors, whose study demonstrated similar findings, eloquently stated that the survival time of patients who underwent breast-conserving surgery was significantly longer than that of patients who had a mastectomy. The first reason, therefore, that a woman with early breast cancer should consider less surgery is that breast conservation treatment results in higher survival or cure rates than mastectomy. Let's look at the data for recurrence for breast conservation treatment. In 2002, it was reported that the local recurrence rate for women treated with lumpectomy plus irradiation was numerically lower than that for mastectomy. Local recurrence, as we are familiar with, is the return of cancer within the same breast that has been treated. When a mastectomy or total removal of the breast is performed, recurrence commonly occurs in the skin or in the layer of fat below, what is medically termed as the subcutaneous tissue, just beneath the remaining skin that covers the chest wall. The combination of lumpectomy and irradiation constitutes breast conservation therapy or BCT. More recently, this team of doctors from the University of Wisconsin School of Medicine and Public Health did a study on recurrence after breast-conserving therapy and reassured women that the low rates of breast cancer, local and regional recurrence after breast conservation in women treated with systemic therapy can support discussion of this surgical treatment options. The second reason to consider breast conservation treatment as a valid therapeutic option is the fact that it has been shown to be associated with a low rate of local and regional recurrence. In general, serious complications after surgery are uncommon. However, they can disrupt life in the immediate post-operative period. To help women recover quickly after surgery and live more in the post-operative period, doctors aim to minimize the risk of complications. Let us look at how the two different operative approaches compare. In 2015, this team of doctors, led by Dr. Chatterjee from Pennsylvania, did a study and concluded that breast conservation surgery, or lumpectomy, has fewer complications with respect to bleeding, wound complications, and infections. This finding was corroborated by a more recent study where researchers from Sweden evaluated complications for patients who underwent breast-conserving surgery or mastectomy. They found that mastectomy with or without immediate reconstruction were both risk factors for wound complications. In other words, patients who undergo mastectomy with or without reconstruction have a higher risk of developing post-operative complications than breast-conserving surgery. There is robust evidence supporting the third reason to consider breast conservation treatment. BCT is associated with fewer complications than mastectomy and allows women to live more in the immediate post-operative period. Quality of life is central to living more in the long term after breast cancer treatment. It is therefore important to compare this domain after surgical treatment. This team of doctors did a systematic review of quality of life, or QOL, in patients with breast cancer after treatment. Their analysis of changes in QOL showed that breast conservation treatment, or BCT, was better in several quality of life domains than mastectomy. These domains included body image, future perspective, and role function. The fourth and fifth reasons to consider breast conservation treatment is that it is associated with better quality of life and body image than mastectomy. This contributes to the likelihood that a woman would be able to live more into survivorship. To recap, we have covered 5 reasons why women may wish to consider less surgery in the form of breast conservation treatment when faced with the need to make a choice. BCT offers better body image and quality of life, which allows a woman to live more in survivorship. Fewer operative complications mean living more in the immediate post-operative period. Recurrence with BCT is acceptably low. The most important aspect is that 10-year survival is better with BCT. That provides a woman with the best chance of living longer after breast cancer treatment. It is our hope that this information will help you or someone close to you choose the treatment option that offers the best chance to live longer and live more. Please click like and subscribe to help more women thrive in their survivorship. You may post your questions in the comment below or submit a request through the Just Medicine website. Let's chat again in the next video.